primeiro lugar, gostaria de cumprimentar todas e todos os presentes. Já estamos com algum atraso, portanto eu vou ser bastante breve. Naturalmente que é minha obrigação dar as boas-vindas e agradecer a disponibilidade, portanto, à nossa estimada Sarah Banks, que é uma referência incontornável, como disse o professor Duarte, é uma referência incontornável no que toca às questões da ética e, em particular, no âmbito do Serviço Social. Agradecer-lhe, então, a sua disponibilidade para proceder à Conferência inaugural. É vasto o seu currículo, é vasta a sua obra, eu vou dispensar-me de enumerar um e outro, até porque o importante mesmo é usufruir da presença da Sara conosco e da partilha das suas reflexões. Esta conferência e o período para perguntas que seguirá irá decorrer em inglês, sem tradução simultânea, sendo que os slides de suporte foram traduzidos para português por forma a facilitar a compreensão às pessoas que possam ter mais dificuldade com a língua inglesa. Sem mais delongas, então, welcome Sarah Banks, and thank you once more for accepting to be the opening keynote speaker in our Congress. Considering the importance of ethical issues to introduce these 2 days of reflection and knowledge sharing. I just said that you are an unavoidable reference in ethical issues, and I think we can say that you are one of the English authors most read by Portuguese social workers. I also remember how vast is your curriculum and your work, which I will not enumerate, not least because the important is to enjoy your presence here today and your reflections. This conference and the question period that will follow will take place in English without simultaneous translation, and the support slides have been translated into Portuguese to facilitate understanding for people who may have more difficulty with the English language. Sarah, thank you once more. The floor is yours.
Thank you, Isabel. I am very honoured to be invited to give this opening talk at your Congress. Bom dia. Unfortunately, as Isabel said, I will speak in English, but I'm delighted that Professor Michel Binet and also Isabel herself have helped with the translation of the slides. Of course, they may have improved them. It may be better in Portuguese than in English, so I hope that is the case. I'd also like to thank the University of Lusíada and Professor Duarte Villar for inviting me here. My theme is about COVID-19, which of course is a big theme in social work today. And I've called it Rethinking Rights, Responsibilities and Risks, Ethical Challenges for Social Workers During COVID-19. And before I actually start, I'll just tell you that, like many social workers, I'm working from home, and at 11 o'clock, between 11 and 1, I may get a doorbell ring to collect a parcel. So if I suddenly disappear, that's why, and I apologize, and I will come back immediately. But I think you all know that kind of thing. Sometimes a dog appears, or a cat, or a child. This is what we're facing during COVID-19. Isabel, would you like to move to the next slide, please? So my plan for this session today is to raise some questions about ethics and social work during the pandemic. I will briefly cover some findings from an international survey that we did with the International Federation of Social Workers on ethical challenges in social work. I'll talk about some of the responses from social workers, and in particular, my themes will be ethical vigilance, ethical reasoning, and ethical logistics, and I'll obviously explain that when we get to it. I have one example from practice. I always like to go into the details of what practitioners are saying and doing, so it's one example from the UK about foster care for children. And I will end by looking at some of the implications for policy and practice. Next slide, please. I don't know what it was like in Portugal, but in the UK, when the pandemic first started, our Prime Minister and the politicians would all come on the TV and they would say, we need to follow the science. And what they meant by that, of course, was not just the politics, or really what they meant was, we want to blame the scientists if things go wrong. If they can say we're following the science, then if the economy shrinks, if more people die than hoped, they can say it was the scientists' fault. That's just a cynical view. But anyway, we had this mantra, we must follow the science. So I was very pleased to read in the British Medical Journal this line: in plotting the way through this pandemic, we need to follow the ethics, not just the science. And certainly, as you all know, ethics is at the heart of the pandemic. It's not just balancing the economy versus people's health, it's issues of individual rights and freedoms versus their own and the public well-being. What harm can we cope with? What about the social justice for the people who've lost their jobs and the families who have no food? Who is responsible for this? So ethics is right there at the heart, and it's good to acknowledge it. But how do we find the ethics? The British Medical Journal said the ethics. It's as if there is an ethical code, an ethical answer. So part of our journey today is to look at not the ethics, but the many ethical issues and answers that social workers have talked about. And I'm particularly focusing today on social workers. There are many, many dilemmas for medical, nursing, and people in their ordinary everyday lives. Next slide, please. So some questions that will frame what I'm saying today, and that actually framed what I was thinking about when I was thinking about ethics during COVID-19. Can social work operate within its existing ethical framework? For example, the Professional Code of Ethics. You have a code in Portuguese. We have the International Federation of Social Workers Statement of Ethical Principles. All countries usually have a code of ethics. Can we operate within our code of ethics during the pandemic? Some social workers got very worried, particularly at the start, saying, I can't practice ethically. I can't practice in the way I think is right. Is that true? Or maybe they were acting in the right way, but they had to prioritize some different principles, some different values. They had to put the public good above individual freedom. And is that right? Perhaps it is in pandemic conditions. So what counts as ethically good social work and right action in pandemic conditions? It requires some extra thought, some rethinking. It's not to say our ethical code needs to change or has changed. It's just that how we apply it is going to be different. We may have to reprioritize our principles. Thirdly, how do social workers decide what to do and carry out their decisions? So I'm quite interested in how you, as social workers, and probably many social work students and social work academics, decided what to do. And I'm sure you will all have your own accounts and your stories to tell. Next slide, please. Because COVID-19 had a profound impact on social work education, social work students, and indeed, as I said, everybody. But in particular for the social workers and the students who might be doing their practical placements, the restrictions on in-person meetings were the thing that has really affected people. The reduction of services, some were closed down, not able to happen. The increasing need from people who were in greater need, greater poverty, unemployment, mental health issues, domestic violence, all of this has been increasing. And the risks are new and complex. We have to weigh up risks of more people. There's many more people to take into account than in what we might call normal times. So in these conditions, can we actually do proper, good, or ethical social work? The British Association of Social Workers did a survey, an ongoing survey actually, not just on ethics, but on all social work. And this was one of the themes that came out of that, people saying they couldn't do proper social work, meaning social work as they understood it, paying care and attention to people's rights, dignity, etc. And in our international survey, again, a British social worker said he felt it was like anti-social social work. And that I thought was a very telling comment, because social work is about the social. It's about being relatively close, building relationships with groups and individuals. So antisocial, where we have to have a distance. And in the English language, we talk about social distancing, that is the physical distance between people. At the moment in the UK, the distance is 2 meters. I'm not sure what it is in Portugal, but many countries do have a distance, and we call it social distancing, which really emphasizes the fact that you are putting yourself apart from people. Next slide, please. So I and a group of other academics from different universities from Canada, Hong Kong, the Netherlands, Italy, Spain, decided that we would do, with the International Federation of Social Workers, a survey on ethical challenges during COVID-19. And we did the survey in May 2020. And we got 607 responses from 54 countries. It was a very simple survey, really asking 2 main questions. What are the kinds of ethical challenges you're facing? And give us one example. And it's those examples that are very telling and give us some very distinctive challenges in different cultures, religions, social work regimes. The stories we get from Iran, or the stories from Canada or China, are very different from the stories from Portugal or the UK. We had 6 responses from Portugal. Sadly, the survey was not in Portuguese. We did translate it into some languages, and we hope to do another survey, and then we will have more time and try and translate into more languages. But what I'm interested today was the kinds of common challenges, and many of the challenges were common, although they were in very different settings and situations. Next slide, please. So we drew out 6 themes from the survey. These are rather long, aren't they, these themes? But it's because we were recognizing the complexity. The first issue, the top issue that people found, was how do you create and maintain trusting, honest and empathic relationships via the phone or the internet, while also paying attention to privacy and confidentiality. And how do we do this in person if we're wearing protective equipment, if we're wearing a mask or a visor or gloves? And that was the big issue. And that was the big issue in May. I think it's still an issue now. There's an issue also that many people, service users, don't have access to the internet, or don't have good access, or don't have good bandwidth. We all find that problem. The second issue was about how do we prioritize the needs and demands, which are getting greater and are different, but resources are stretched. And we can't do a full assessment. If you can't go into a person's home, then you have to do something lesser, perhaps on the internet. Thirdly, how do we balance service user rights, needs and risks against the personal risk to social workers and their families and other people, the public, to provide services as well as we can? Fourthly, having to decide whether to follow national and organisational policies, procedures or guidance, whether these are existing or new. And certainly in the UK, we had new guidance for the pandemic. Or do we use professional discretion in circumstances where policies seem inappropriate, confused or lacking? And I'm sure many of you will have found that. Sometimes no policies were available, no guidance was given about on what grounds you should actually enter a service user's home. Sometimes there was guidance, but the social worker felt it wasn't taking account of particular circumstances. Fifthly, how do we acknowledge and handle emotions? That was a big theme, and I'm sure it is amongst you even now. I think fatigue and the need for self-care when working in unsafe and stressful circumstances. Certainly in the UK at the moment, this is still carrying on because things are not back to normal by any means. And finally, some social workers use the opportunity in filling in the survey to reflect on how we can use the lessons we've learned during the pandemic to rethink social work in the future, that we maybe won't go back to exactly what we had before. How can we make things better? How can we avoid the kind of unfairness and chaos that we've witnessed this time? Next slide, please. So I'll very quickly now go through each theme. I'll usually just give you one or two quotes from the survey. So this doesn't do justice to all the answers, but it gives you a little feel for the kind of things people were saying, and I'm sure they will resonate with you. So from the Netherlands, about working on the internet, the social worker said that she experienced a dilemma in 4 families. She doesn't have a good view on the level of tension and possibly domestic violence. My ethical dilemma is I actually do too little. I don't know what to do because it's obvious all the children in these families suffer more emotional damage than normal and don't get it prevented. Video call conversations have far too little depth, take less time than a home visit. I can't get the children out of their situation. That's what's bothering me. So this social worker feeling powerless, only able to speak on the internet, not knowing what's going on, can't smell, see, feel, hear the home and the people and the relationships in it. And that is bothering her. Next slide, please. Secondly, how do we prioritize the service user needs and demands? And here is a quotation from a Portuguese social worker who worked in a private youth organization. It is quite difficult to prioritize. One dilemma that occurs every week is, it was only possible to support one family. In choosing between a family with young children and another family with young children, how to proceed in the most ethical way possible. A true dilemma. There's actually no right answer to that, at least no obvious right answer. This situation gives me an unpleasant feeling. Firstly, because I do not feel comfortable in denying food at such a time as this, and secondly, because I do not want to be the one who chooses between people who need support. In social work, we always have to prioritize, but what the social worker here is saying is it's just different. There's more tough decisions to be made than we're used to. Next slide, please. Thirdly, balancing the user rights, needs and risks against the social workers and the public. And 2 quotes, one from Rwanda, a mother, social worker. I'm in a situation where I think I have to make sure I pay attention to not contaminate my children and my husband. So obviously social workers are always concerned about their own safety in unsafe conditions, but normally just making a visit or accompanying a child would not be a high-risk situation. Now it is. From the UK, and this is from a fostering social worker who we hear from later. I'm used to assessing risk in others, but now I am a potential risk. And now I am at potential risk, meaning she could give someone the virus and she could catch the virus from somebody. This makes me feel very uneasy. Next slide, please. The 4th issue, deciding whether to follow national and organisational policies and procedures or use professional discretion. And this example comes from Nigeria. A social worker working in a hospital reported that during the pandemic, there was no cash withdrawal from banks. So relatives of hospital patients were unable to pay for services in the hospital. They had to pay, but they didn't have a means of getting the money. So social workers gave their personal bank account details to the relatives, so the relatives could transfer the money needed, and that meant the social workers could withdraw the money through a cash machine. This was against the hospital rules because service users were putting money into a social worker's bank account. But the social workers decided to use their discretion because they felt there was no other alternative. Next slide, please. The 5th theme is about emotion fatigue. And here's a quote from Italy, and this was early in the pandemic, and as you remember, at that point, Italy had experienced a very, very severe set of outbreaks with hospitals very full. And a children's social worker described complex emotions associated with a case involving a very difficult ethical decision to place children with foster parents, explaining afterwards, "I still felt in trouble and worried. Emotionally, I felt powerless because of the pandemic condition, grateful for the availability of the resource, and guilty because of the potential risk of contagion." So key words there about anxiety and guilt and feeling powerless. And that really drags social workers down. And I'm sure you've all felt some of that when you've really not known if you've done the right thing or not, or even though you did do the right thing, there were still risks. And a very graphic comment from a Chinese social worker. In China, the social workers were very much involved in going house to house, checking people were following the rules, giving out testing kits, delivering food. And this social worker said, "We felt sad, stressed, and sometimes exhausted. We didn't have time to think and reflect. I felt like I was at a war." And that really emphasizes the feeling of it being a crisis, of being very unusual, not having time, just having to act. Next slide, please. But this leads into the next one, which is really the importance of thinking carefully and using the lessons learned to rethink social work in the future. And this is just a quote from a Spanish social worker who said, "We need to reinvent social work, but there are some resistances against it. The ethical challenge is more structural than personal," meaning, of course, that the lack of resources, that the way the pandemic has been dealt with is at a systemic governmental level, and social work needs much more recognition, support, and the service users need to be cared for much more by both the state as well as the social workers. So it's not the personal responsibility of the people who use the services, nor is it the personal responsibility of just social workers to make some good decisions about who not to give the food parcel to. Next slide, please. So those were just a sample of the challenges, and I'm sure you can tell me many more challenges that you have faced on a daily basis as you've tried to go about your business and tried to practice ethically. What I'm very interested in that topic, what have social workers been doing about these challenges? How have they tried to practice ethically during the pandemic, even though this might have been hard? What ethical guidance is needed or available? Next slide, please. And in looking at the data from the survey, 3 themes have come out to me as I've been reading through and thinking about some of the detailed descriptions that social workers have given about what they were actually doing during the pandemic. And obviously these were accounts that people have given afterwards. They've given them to me, a researcher, or to our research team, and so they're presenting a certain picture of themselves and what they're doing. But nevertheless, it's interesting to see what it is they're saying. And so this theme of ethical vigilance came through. That term was used by a social worker. She was an American social worker working in the UK. And she used this term ethical vigilance, and I rather liked it. So I've developed the idea a bit. And by ethical vigilance, we mean heightened awareness of one's own stress and anxiety, dangers of ignoring or harming people or infringing rights by acting or reacting unthinkingly, and the need to look for hidden ethical issues. So that is about, even though there's a crisis and you feel like you're at war, you have to step back and be aware of the impact of your own emotions. Are you looking at this carefully enough? Might there be another ethical issue in there? Is there somebody you've ignored? In that family you're working with where you can't see everybody, is there somebody in the background that you need to bring forward? Ethical reasoning, we're all used to this. This is a common feature of working on ethical decisions and dilemmas in social work, weighing up risks, rights and responsibilities of different people. But during the pandemic, we've had to rethink this. Although we may have prioritized individual freedoms, choices, autonomy, during the pandemic, we may have to prioritize their welfare or the public welfare or the welfare of the neighborhood. So we have to reprioritize, recalibrate, and rethink. So again, this is about doing slower ethical reasoning, not relying on the reasoning we've always done, but having to say, well, we're in a new situation. We need to take account of that. And the final concept is that of ethical logistics. This term was coined by a member of our partnership, Jane Shears, who's from the British Association of Social Workers. She was in our research partnership, and she talked about logistics. And so again, I developed this a little bit. Logistics is obviously about, often we think about it, getting supplies and materials in military sense to the right place at the right time. So it's a practical effort and a lot of planning that's needed. If we're going to act on our ethical judgment, we might decide the right thing is to go and visit someone in their own home, even though there are some risks. But how do I do that? What equipment do I need? What precautions should be taken? How do I arrange it? So having to ensure that you've made all the possible plans to make sure that people are safe, that we can work with them in as dignified and confidential a way as possible. And again, that requires some new ideas, new thinking, and a lot of planning and a lot of effort. Next slide, please. So very quickly, ethical vigilance. This is the quotation from the social worker who introduced this concept. The pandemic necessitates a much higher level of ethical vigilance than I typically need to do my work ethically and well. I am tired, overwhelmed, and emotionally drained. It takes more energy to be vigilant about confidentiality, not making the thoughtless or snarky remark, the irritable remark, and to focus on all the implications of every choice, the things I normally find it so natural to consider. Next slide, please. So this comment shows the sheer physical and emotional exhaustion generated by working during the pandemic, the sense of professional responsibility to practice ethically and competently, the effort and self-knowledge required to maintain confidential and respectful relationships, and the time and mental energy needed to consider all the implications of every choice and decision, some of which were previously regarded as routine. Next slide, please. Ethical reasoning. This comes from the manager of a charity in Germany. In all areas of social work, ethical issues are at the forefront, always dealing with the questions of justice. But the corona pandemic put the system to the test. Decisions have to be made here in older people's homes every day about who comes first and what is the most necessary. The risks to the staff, the risks to the older people, what about the relatives? Should they be allowed in or not? Should anybody who's ill be sent to hospital? There might be a danger of catching COVID. So many issues. Next slide, please. This comment illustrates that questions of distributive justice are always present in social work. We're always having to make these kind of decisions, but the pandemic demands more prioritization as needs are greater, resources are scarce, and many older people's care homes were short of staff because some staff were ill with COVID, for example. This requires daily work of ethical decision making, so more work to make decisions. Next slide, please. Finally, the logistics. I like this quote, which again came from a UK social worker. Carrying on delivering social work is a kind of intriguing puzzle that lots of very creative and determined people are trying to solve. And I'm sure you are amongst those creative and determined people. Next slide. This slide comment illustrates the difficulties in continuing to provide a social work service at all, particularly, I think, in many countries at the very start of the pandemic when there was an immediate lockdown and many services decided to close. How do you reopen them? What can you do instead? The complexities and hard work required, the need for creativity and determination, and above all, the need for collective effort of many people to find solutions. I remember there was a social worker from Brunei who said social work is not a work of one. So we're not the lone individual social worker struggling to try to decide what to do and how to deliver a better service. It's down to us all, as well as our local politicians and managers, to get involved. Next slide, please. Now, we've probably just got about 5 or 10 minutes left. Hopefully that'll be okay. Do tell me if you want to move faster, Isabel, I'm sure you will. This is a case from the UK, and I must explain, I've been reanalyzing the UK data. So I've got the UK examples, which obviously I can understand better as well because I understand the UK. I've used quite a lot of UK examples in this presentation. And this is about moving children into foster care during the lockdown period. So lockdown being when social workers were told to work from home if possible. Many offices were closed. Home visits were not really allowed unless exceptional circumstances. And at this point, a decision was made to apply for a care order to remove 2 young boys from their grandparents into foster care. The grandparents weren't able to look after them. Anticipating the care order would be granted, the social worker made a video explaining the move and introducing the foster carers to help ease the transition. So here we have some advanced planning, a caring approach on the part of the social worker. The logistics involved in doing this explanation, how do you do this when you can't see them? We'll do a video. The social worker attended court via teleconference. She'd only met the children via video call, as had the guardian ad litem, that is the person appointed to look after the children's interests. When asked by the judge for her views, the social worker wondered, could we really advocate for their wishes and feelings? So here she's reflecting on roles, responsibilities, and being vigilant, ethically vigilant about, am I in a position actually to say what the children really want? Next slide, please. The care order was granted. The social worker decided to move the children in her own car to limit the number of people involved, instead of the usual practice of taking a taxi. She did this because she would expose herself and her partner to more risk, but she felt it would be safer than exposing herself and the children to the risks from a taxi. So here she was doing a calculation to minimize the risk, so making reasoning and logistical plans. Although she had gloves and a mask, she didn't wear the mask because she thought the children were scared and confused without having a stranger wearing a mask taking them away. So she was balancing the risk to herself and the children against the children's feelings. She couldn't maintain a social distance from the children. She carried the baby downstairs. She held the hand of the older one while crossing the road. There was no other option. She also came close to the foster carer. So here she recognized the need for social distance, but she judged it was impossible. So her reasoning there that she needed to be close to these people for their own safety. She also made the choice to spend time with the children, settling them in, as opposed to leaving, while recognizing this increased the levels of risk to all parties. So she made a considered choice to take risk, making a reasoning judgment there. Next slide, please. The social worker said she felt anxious throughout. She received little guidance or emotional support from her manager. She commented, I'm used to assessing risk in others, but now I am a potential risk, and now I am at potential risk. This makes me feel uneasy. So she's reflecting on the new sources of risk here. She's vigilant about this. She concluded, despite how I was feeling, I was determined to make the move as smooth and easy for the children, as their move into foster care will be something they remember forever. So this is about her carrying out her role as well as possible in the interests of the children. And that idea of being a good social worker, this is my responsibility as a social worker. This is a big deal for these children. I've got to do my very best. And this was her reasoning for why she put all that effort into doing what she did. Next slide, please. So this account illustrates some of the usually hidden micro decisions and reflections as told by the social worker afterwards. The interconnectedness of the practical and ethical components of any decision. It's very hard at a micro level to say, well, where is the ethical in there? That they are completely intertwined. And I think the idea of logistics, the need for practical planning in order to be ethical is quite interesting and important. And finally, the complexities and difficulties of everyday practice. You've got to assemble the psychological, emotional, and material resources in the right place at the right time for the right reasons. And for any of you who know Aristotle, the Greek philosopher, you might recognize the hint to his concept of phronesis, or practical wisdom there, always judging what to do in accordance with those particular circumstances. An overall rule doesn't always cover it. And I think particularly in COVID-19, social workers are finding that the usual rules may not apply. Even the new rules may not apply in every case. You have to decide in the right place, the right time, and for the right reasons. So that's the rethinking that comes in. Next slide, please. So what are the overall lessons from the survey? I've given you a very brief flavour of what was in the findings of the survey, and there was much more in there that I can't talk to you about, but I think you'll be able to tell me about your experiences too. But what struck me about practicing ethically in times of uncertainty and crisis is what hard work it is. The need to take time to reflect, to reaffirm values, and above all to consult with colleagues. And that was a key issue that came out of the survey, that quite often that bit was missing because you weren't in an office and you couldn't easily speak. Doing the hard work of ethical vigilance, reasoning and logistics, handling and using emotions, and maintaining professional integrity. That social worker that we just looked at talked about her responsibility really to make sure these children had a good experience. She wasn't going to cut corners because it was a pandemic. She could easily have done that. She could easily have not been present. She might not have held the hands. We may debate whether it was right or wrong, what was the risk, but she wanted to maintain what she thought was good and proper social work. Supporting each other, social workers supporting each other through the inevitable moral distress at what should have been done but was impossible. So the Dutch social worker that we encountered at the start, who had the 4 families and felt that she or he couldn't do anything and felt upset at that. The sense of moral injury about what was done that should not have been. Moral injury is a concept usually used when soldiers during wartime actually kill people or commit injustices that they then feel their moral self has been injured. And I think we had some examples which I haven't shared with you during COVID-19, which you may have experienced, particularly when people were discharged from hospital into care homes and either took COVID-19 from the hospital into the home or caught COVID-19 into the home, and social workers were wanting to resist this but found they couldn't, and they felt very damaged by this. But positively, sharing a sense of satisfaction, relief or happiness over a job well done, this fostering a social worker, I think, felt she'd done a good job, and being prepared to advocate, mobilise and organise with and on behalf of people who are marginalised during the pandemic, for whom resources and services are inadequate and stigmatising. And I think the Portuguese social worker we referred to earlier, who was having to prioritise who gets resource and who doesn't, who gets the food and who doesn't. It's not just a problem for that social worker, it's an issue for society as a whole and for government and for the Professional Association of Social Workers to take a lead to say things need to change, we need more resources. Next slide, please. So we're now coming to the concluding comments. The importance of paying attention to social work ethics in challenging times, that's obvious, but going back to that beginning quote from the British Medical Association, we mustn't just follow the science, the politics and the practice, but we need to follow the ethics, or we need to follow some ethical frameworks, and we need to take responsibility ourselves and with colleagues for thinking through and rethinking what is ethical. The need to look behind the rhetoric of following the ethics to work out what this means, and the continuing need to advocate for the role and values of social work with policymakers and employers. And I'd be interested to know in Portugal whether Portuguese social workers were regarded as essential workers or key workers, as doctors and nurses were. In the UK, our social workers were regarded as essential workers, but that still didn't mean they got the right amount of protective equipment. They weren't valued. It wasn't realised in the early days how important social workers were when society was in such chaos. So this needs to be constantly said to the policymakers. And I know that the IFSW and the national associations of social workers have been doing this quite consistently during the pandemic. And the very last slide is to show you if you want to download the report. So next slide, please. There is a slide which shows you how to download the report if you want. And there's an article we published, I'm afraid it's in English. And we also produce some ethical guidelines for social workers for working during the pandemic. So that is the end of my talk. So I'll now pass back to you, Isabel.
Thank you, Sarah, so much for your inspiring conference. 2 ideas I would like to point out: the ethics vigilance and the ethics logistics, because we think as logistic as something very practical, but in this case, it's a very important matter, how we think ethical about this. I think your conference, it's very inspiring to help us reflecting in the great ethics challenge we face nowadays in this context. I will now open the floor to 1 or 2 questions. It's not possible to do more because time is running, but if someone wants to present some question to Sarah, now is the time.
And Isabel, you could probably stop the screen sharing then.
Yes, I will do it. I only keep these here a few minutes, yes, so that if someone wants to copy the link, yes, but now I stop. And if someone wants, I think we can copy this to the chat, is more practical.
Yeah.
Okay, now here we are. In the hand, I will do that. Now, if someone wants to present some question, now is the time, please.
I think we have one in the chat. I don't know if you want to take that from Paula. How can we reconcile the exercise of our profession with ethics when our work team is only concerned with their well-being and not with the patient? Yeah, that is a very difficult challenge. And the issue is to persuade the work team gradually that while taking account of their own well-being, they also have to take account of the well-being of the patient. And I think that is hard. What I noticed in looking at some of the responses from the survey, and also the British survey, which happened over time, they were collecting data, they're still collecting data, is as the people got used to working during the pandemic, they began to realize what was safer and what was less safe, and how things could be done and should be done, and that they did have a duty to do the best they could for service users, and would start to do things that they hadn't been able to do at the start. So but I think that is a very intractable problem. Thank you for raising it.
Thank you. One more question. If someone. Some more thanks.
Well, you don't have to say it in English. Please say your question in Portuguese, and I think Isabel will translate it.
Okay, it's a good suggestion. Yes. Se alguém quiser colocar alguma pergunta em português, poderá fazê-lo, por favor, e nós procuraremos ajudar com a tradução.
Anna. Yeah, Anna is asking about the text research. Did you mean text research or next research?
Sorry, it's just on my computer. You talk about the next research that you are going to plan, and I'm really interested on this. I know we are discussing in Europe about this part.
Well, we're meeting next week with Rory Truell and various other people from the group to discuss doing another survey. And we'd be really interested to hear from you, Anna, and anybody in this group. What kinds of questions should we be asking now? Because what we're interested in is, rather like I responded to Paula, what is happening now? How have social workers reflected on and got used to this new situation where there is still some restriction, still some distance, but we have to live with it and we have to do the best we can. What creativity, one of the social workers I quoted was talking about creativity and determination. So where has social workers' creativity and determination taken them? And I'm sure everybody in this room, even if you don't want to say it to me in English, would be able to tell me some stories about the creative things you have had to do during this period in order to keep things going. But I would love to hear from you, Anna, and perhaps we could talk about what questions we could ask in this new survey.
Yes, it would be a pleasure. And you know, Sarah, there is a discussion now about moral injury.
Yeah.
And I think this is a really important topic. As a practitioner, I was in the situation to consider this moral injury during this time. And I think this will also be an important issue if you consider it, because we are facing it in our profession.
Yeah, okay, yes, that is a good point. So to particularly look at that, and I see Teresa has said that seeing there are a lot of points to analyse here, what could you say would be the key words we should focus on in the coming time so we can maximise our results professionally and handle it emotionally? Well, probably those three key messages about being vigilant. So in English, I think of vigilance as being having antennae. We have to look out. There's a tendency to look narrowly because we're just looking on the screen and we're on the phone. And so how can we see the bigger picture and take time out to reflect? So to do different kinds of rethinking and ethical reasoning, to be prepared to do the logistics, the extra effort, but above all, the vigilance, I think, is very important. And talking to colleagues, making time for team meetings, making time for your professional association to hold meetings on ethics. Our British Association is going to have some materials for continuing professional development, looking at some cases that came out of the research. And I better stop now because I think it's time.